All right, welcome everybody. Today's topic is going to be on everybody's favorite topic, which is Medicare. So that's going to be a segue into what are our healthcare options as we approach retirement, right? And when we think of retirement age, it's age 65, but that doesn't mean that we necessarily retire. Everybody's circumstances are different, but this is going to be the topic. So without further ado, annual election period. What does this mean? I'm going to get into the definition here in a second, but just for your notes, it's between October 15th, which is coming up next week, until December 7th. But you're going to see a redundant theme or a recurring theme. This is not open enrollment. They are two different things, and we'll talk about those here shortly. So overview, what's the AEP? What changes can be made? And what must enrollees? We're going to do a deeper dive on each of these three topics here. So what's the AEP? Annual Election Period. The CMS, or the Center for Medicare and Medicaid Services, describes the annual election period from October 15th to December 7th as the time when all people with Medicare can change their Medicare health plans and prescription drug coverage for the following year to better meet their needs. New coverage takes effect January 1st. So what does that mean in English? Means if you are approaching age 65 and have not elected a Medicare option, a healthcare option, we're going to touch on that. This really is appropriate for people that have already sort of rounded the horn, that they are already in some type of plan, right? That they're either on Medicare Advantage or on a Medicare supplement, something called Medigap, or a Part D drug plan. Let's say that one of those. So you're going to see here, if you're newly eligible for Medicare. So I have a client that just called our office and he will be 65 in December. We're going to go over that. You don't have to wait until this period to sign up for Medicare. That's where it gets confusing, because even Medicare, a lot of the information that comes from CMS, sometimes we'll call this open enrollment, when in fact, when you're approaching age 65, right, there's this window that we're going to go over, this period of time that you actually can do it prior to, so you don't have to wait. This is something that we refer to as the IEP, your initial enrollment period. They are different. So what can you do during the AEP? And I know they're acronyms and there's a lot of them, but it really, just think of it, annual election period, right? So it's what can we do every year? Well, we can change. We can change as long as there's not been a change with some underlying conditions. So the common scenarios for AEP, these are the three main ones: original Medicare, so that's parts A and B, plus the supplemental. It's called Medigap. You'll hear us talk more about that. Medicare Advantage plans are where the insurance companies have taken over all aspects of the health insurance, the insurance component and the drug component, and combined it into a package that they call Medicare Advantage. And then let's say that you only have Medicare, right? So parts A and B, with or without Part D. These are the three scenarios where you can utilize a change as it approaches. So change your Part D. If you're in a standalone Part D prescription drug plan, we want to encourage you that every year that this happens, you should really check the formularies. These insurance companies are changing that on an annual basis. Formulary is a list of drugs that are considered tiered, you know, they're name brand drugs versus a generic version, and what drugs insurance companies might, with one carrier, might be considered a higher tier or a more expensive version with another carrier. So you want to get your list of drugs together, check the formularies before you elect them. Now, not only can you change your Part D, but you can also enroll in Part C. So what does that mean? Part C, and it gets really confusing because of all the letters, right? So remember, A and B are hospitalization and doctor's visits, and D is drugs. C is a bridge that the government and insurance companies have agreed to, where they're going to quarterback everything. Those plans are different. And then lastly, right, you can change carriers. You can change your insurance companies during this time. Now, we had mentioned that, and you're going to see here in Medigap that when you can change with that, but when you can change. So let's say that you're with AARP, you're with their United Healthcare is who they use, and you're with their Plan C. and you want to change to another plan C, let's say with Aetna, you can do this during this time and there's no restrictions. So there's three themes here so you can change from one Medicare Advantage, that's Part C. So Medicare Advantage and Part C mean the same thing. You can add enhanced dental and vision coverage during this period of time. Now remember, the supplemental plans don't come with vision and dental. That's got to be done separately. Listen, I know that stuff's expensive, but not nearly as expensive as to what a major claim catastrophic coverage could cost. So be careful of the shiny objects or the free stuff that they claim that you get. And then you can apply for Medigap coverage and Part D during this period of time. So if you're enrolled in Medicare Advantage, you can do any of these three things. So if you're enrolled in original Medicare, and I know the nomenclature gets a little confusing, this is what I also refer to as Part A and B. So if you're enrolled in original Medicare, Parts A and B, you can enroll in a standalone drug plan. You can enroll in a Part C or Medicare Advantage. You can enroll in a Medigap plan, which is supplemental, and you can change your Part D coverage. But let's make this clear. What is this not? This is not open enrollment. AEP, Annual Election Period, is not open enrollment. And quite often, even that's why I said, even information coming out of CMS, emails have been claimed open enrollment. It is not. Open enrollment is something separate and apart. Annual Election Period, I just went over. So Medigap, which is put in parentheses, supplemental. So you have Part A and Part B, but you want a better plan. In my opinion, I think the supplemental plans offer more value, but you have to shop them. They have an open enrollment period. So what that means is your Medigap open enrollment period is a 6-month period. It's the month begins the first day of the month. When you enroll in Part B, now your open enrollment is there. And it's now goes into the last day of the month of the 6-month following. So that is the period of time. So anytime during the year that you turn 65 is technically an open enrollment for you. So you don't have to wait to this annual election period, because the annual election period is just if you have a plan, you want to change it, and it goes into effect next year. Now the Medicare annual election period, right? So this is your AEP begins now, right, next week, and now goes until December. So there are two different periods, but it goes into effect on January 1st of next year. So again, Medigap open enrollment and Medicare annual election period are just two different periods of time. So what should you do? So we put a timeline together just to help you to understand. The timeline of what you should do during this annual election period. One, watch your mailbox for your annual notice of change. Remember, this is if you already have some type of plan. Your existing plan is going to send you something called, that we have an acronym, like we don't have enough of those already, called an ANOC, right? An annual notice of change. And they're also going to supply something called you evidence of coverage. So that's what's going to come in your mailbox on top of all the other solicitations. So something you might come across looking like this. This is SilverScript as a pharmacy company that's available here in New Jersey, and it shows annual notice of changes for 2020. So look for something like this, or if they're going to change your plan, well, first of all, what they're doing is they're changing the premium. So what they said is, hey, listen, our monthly plan premium for this Part D coverage was $65.30. And now it's going to $76.90. And this is the evidence of coverage. Now, step 2, compare your current plan to other plans in the market. And I think this is important, but you know what? It's so overwhelming. How do you do this? How do you do this with any certainty that your specific needs and circumstances are being met? Well, the answer is you call us. That's what we do. Our office, between Caitlin, myself, Keith, Alan, we can help you with this stuff when you have questions. So it is confusing. You don't have to do it alone. Write this phone number down or share it with somebody that you know that is struggling with this stuff. We're here to help. And then lastly, enroll in a new plan that best fits your needs, or keep your current coverage. So the medical election period, right, we talked about it ad nauseum, is 10/15 to 12/7. You have to make this change in between this time frame. You're going to be seeing a lot of information about this, TV commercials, things of that nature. And then it goes into effect January 1st of 2022. Now, 2022 changes. A couple things, notice that the Medicare Advantage plans will be lower. So the average premium for these Part Cs or Medicare Advantage will be lower. Now, that's not typical when you're seeing insurance premiums. You go, oh, that sounds nice. So, it's going to be $19 compared to $21 in 2021. So that's good news for people that are on a fine-tuned budget. Now, the average Part D coverage will be $33 compared to $31. So that went up. So depending on the formulary, depending on the ultimate choice, that's a small increase. Now, these are rumored. These next two, Part B premium was $148. They're not out yet. They haven't come out yet. They're soon, but it's rumored to be up about $10. So from $148 to $158, that's for your Part B premium, which is, hey, listen, that's deducted from your Social Security check, or if you're still working and you haven't filed that, then you get an invoice from the federal government. And then Part B deductible is $203. In 2021, it's rumored to increase to $217. Now, this next slide is one of our clients that had a question because they were being lured in by this Medicare Advantage. And I don't know if you can see my arrow here, but everybody hears about these no-cost monthly premium Medicare Advantage plans. And you know what? They are good when you free is my favorite four-letter word. But just because there's no premium does not mean that there's no cost. And what I mean by that is that if you should go out on claim, this is one of the best plans you can get. And Medicare is a Plan G. This is Medigap, which is a supplemental. Premium's about $150, but he's got a deductible. Well, okay. And you see that you go in for a hospital inpatient or a hospitalization is $0. You go in under a Medicare Advantage plan and it can start to add up real quickly should you have a bad day, right? So I just say, listen, understand your needs. Only you are going to know your circumstances. Look at your drug coverage, evaluate it, talk to your loved ones, reach out to us, think this through, but don't make knee-jerk reactions just because the premium looks attractive. Now, Aep Recap, what is it? Again, it's the annual election period. When is it? It's from October 15th and it ends on December 7th. And what to do? Review and access your current coverage and decide if you need to make a change. This is not open enrollment, and there are limits on what you can do during the AEP. So these are disclosures from our compliance, and just make sure that any of the terminology that we've used is not by them, and it's all been through compliance. But bottom line is, thank you. All of us here, I look forward to, I'm always a phone call away. I really do appreciate each and every one of you being on here each week. And again, if we can help in any way, let us know. Reach out, 732-302-1810, and have a great day. Bye-bye.